Medical Surgical Nursing Performance Test. Question 1. A patient is receiving discharge instructions after experiencing a stroke. Which instruction is most important for preventing another stroke? Take prescribed antihypertensive medications regularly. Engage in physical therapy exercises. Follow a low-fat, low-cholesterol diet. Attend regular follow-up appointments with the healthcare provider. A. Take prescribed antihypertensive medications regularly. Correct answer. The correct answer is A. Take prescribed antihypertensive medications regularly. This is the most important instruction for preventing another stroke because hypertension is a major risk factor for strokes. By controlling blood pressure with antihypertensive medications, the patient can significantly reduce the risk of another stroke. Engaging in physical therapy exercises, choice B, can be beneficial for overall recovery but is not as critical for stroke prevention as managing blood pressure. Following a low-fat, low-cholesterol diet, choice C, is important for heart health but not the most crucial for stroke prevention. Attending regular follow-up appointments, choice D, is essential for monitoring progress and adjusting treatment but does not directly prevent another stroke like managing hypertension does. Question 2. A client with heart failure has gained 2 kilograms 4.4 pounds in the past 24 hours. What action should the nurse take first? Restrict the client's fluid intake. Assess the client's respiratory status. Administer diuretics as ordered. Notify the healthcare provider. B. Assess the client's respiratory status. Correct answer. The correct answer is B. Assess the client's respiratory status. The first action should be to assess the client's respiratory status as the weight gain could indicate fluid retention leading to pulmonary congestion, a common complication in heart failure. By assessing the respiratory status, the nurse can determine if there are signs of respiratory distress such as increased work of breathing, crackles, or shortness of breath. This assessment will help in identifying any immediate need for interventions such as oxygen therapy or diuretics. Restricting fluid intake, choice A, is important but not the first step. Administering diuretics, choice C, should be based on assessment findings. Notifying the healthcare provider, choice D, can be done after assessing the client's respiratory status. Question 3. A client with diabetes is experiencing symptoms of hypoglycemia. What should the nurse administer first? 10 units of regular insulin subcutaneously. 50 ml of 50% dextrose solution intravenously. 1 mg of glucagon intramuscularly. 15 to 20 grams of fast-acting carbohydrate orally. D. 15 to 20 grams of fast-acting carbohydrate orally. Correct answer. The correct answer is D. 15 to 20 grams of fast-acting carbohydrate orally. In hypoglycemia, the immediate goal is to raise blood glucose levels quickly. Fast-acting carbohydrates like glucose tablets or juice are the most effective and fastest way to raise blood sugar levels. Administering insulin, choice A, would further lower blood sugar levels. Intravenous dextrose, choice B, is appropriate for severe cases but may not be necessary as the first step. Glucagon, choice C, is typically used if the client is unconscious or unable to consume oral carbohydrates. Question 4. A nurse is caring for a client with a new diagnosis of type 1 diabetes. What is the most important aspect of teaching the nurse should focus on? The importance of regular exercise. Proper administration of insulin. Maintaining a low carbohydrate diet. Recognizing signs of hyperglycemia. B. Proper administration of insulin. Correct answer. The correct answer is B. Proper administration of insulin, because it is crucial for managing type 1 diabetes. Insulin is essential for regulating blood sugar levels in type 1 diabetes patients. Without proper insulin administration, the client's condition can deteriorate rapidly. Regular exercise, A, and a low-carbohydrate diet, C, are important aspects of diabetes management, but they are not as critical as ensuring proper insulin administration. Recognizing signs of hyperglycemia, D, is important, but knowing how to administer insulin correctly takes precedence in effectively managing type 1 diabetes. Question 5. A nurse is assessing a client with a history of seizures. Which assessment finding requires immediate intervention? The client is experiencing an aura. The client's anti-seizure medication level is within the therapeutic range. The client has been seizure-free for 2 years. The client's seizure activity lasts longer than 5 minutes. D. The client's seizure activity lasts longer than 5 minutes. Correct answer. The correct answer is D because prolonged seizures lasting longer than 5 minutes can lead to status epilepticus, a medical emergency that can cause brain damage or even death. Immediate intervention is necessary to stop the seizure activity. Auras, A, are warning signs of an impending seizure and do not require immediate intervention. Anti-seizure medication within therapeutic range, B, indicates proper management. Being seizure-free for 2 years, C, is a positive outcome but does not require immediate intervention unless a seizure occurs. Question 6. When caring for a client with Alzheimer's disease, what is the most appropriate communication technique for a nurse to use? Providing detailed explanations. Speaking in a loud and clear voice. Using simple and direct statements. Offering multiple choices to the client. C. Using simple and direct statements. Correct answer. The most appropriate communication technique for a client with Alzheimer's disease is using simple and direct statements, choice C. This approach is effective because it helps reduce confusion and enhances understanding for individuals with cognitive impairment. Complex explanations, choice A, may overwhelm the client. Speaking loudly, choice B, can be perceived as aggressive or intimidating. Offering multiple choices, choice D, may lead to decision-making difficulties. Therefore, choice C is the best option for clear and effective communication with Alzheimer's clients. Question 7. A client with Parkinson's disease is prescribed carbidopa-levodopa, Signmit. What should the nurse include in the teaching about this medication? Take the medication without a high-protein meal. Expect the medication to take several weeks to reach full effectiveness. The medication may cause urine to turn light. You may experience a rapid heartbeat as a common side effect. B. Expect the medication to take several weeks to reach full effectiveness. Correct answer. The correct answer is B. Expect the medication to take several weeks to reach full effectiveness. This is because carbidopa-levodopa, Signmit, is a medication used to treat Parkinson's disease by increasing dopamine levels in the brain. It takes time for the medication to build up in the system and reach its full therapeutic effect. Choice A is incorrect because it is recommended to take carbidopa-levodopa with a high-protein meal to help reduce potential gastrointestinal side effects. Choice C is incorrect as the medication does not typically cause urine discoloration. Choice D is incorrect as a rapid heartbeat is not a common side effect of carbidopa-levodopa. In summary, choice B is correct because it aligns with the pharmacokinetics of the medication, while the other choices are not consistent with the usual effects and recommendations for carbidopa-levodopa. Question 8. When caring for a client with acute renal failure, which laboratory value is most important to monitor? Serum sodium, serum potassium, serum calcium, serum chloride. B. Serum potassium. Correct answer. The correct answer is B. Serum potassium. In acute renal failure, impaired kidney function can lead to electrolyte imbalances, especially hyperkalemia, which can be life-threatening. Monitoring serum potassium levels is crucial to prevent cardiac complications. Serum sodium, A, may be altered, but potassium is more critical. Serum calcium, C, and chloride, D, levels are important but not as directly impacted in acute renal failure compared to potassium. Question 9. A client is 4 hours postoperative following abdominal surgery. The client's blood pressure has dropped from 120/80 mmHg to 90/60 mmHg. What action should the nurse take first? Administer an 4-fluid bolus. Check the surgical site for bleeding. Place the client in a Trendelenburg position. Notify the healthcare provider. B. Check the surgical site for bleeding. Correct answer. The correct answer is B. Check the surgical site for bleeding. This is the first action the nurse should take, as a sudden drop in blood pressure postoperatively could indicate internal bleeding, a common complication after abdominal surgery. By assessing the surgical site for bleeding, the nurse can identify and address the source of the hypotension promptly. Administering 4 fluids, choice A, may be necessary but should come after determining the cause. Placing the client in Trendelenburg position, choice C, is not recommended as it can worsen venous return and increase intracranial pressure. Notifying the healthcare provider, choice D, should be done after the nurse has assessed the situation and taken immediate action. Question 10. A healthcare professional is assessing a client who has a new onset of confusion. Which laboratory value should the professional check first? Blood glucose level, serum sodium level, serum calcium level, blood urea nitrogen, BUN. A. Blood glucose level. Correct answer. The correct answer is A. Blood glucose level. The healthcare professional should check the blood glucose level first because hypoglycemia or hyperglycemia can cause confusion. Hypoglycemia can lead to altered mental status quickly and should be ruled out immediately. Checking the serum sodium level, B, serum calcium level, C, or blood urea nitrogen, D, can be important in further assessment, but addressing the blood glucose level is the primary concern in this scenario to rule out any immediate life-threatening conditions related to glucose imbalance. Question 11. A client is scheduled for a colonoscopy and receiving education from a healthcare provider. Which statement by the client indicates a need for further teaching? I can have clear liquids up to 2 hours before the procedure. I need to take a laxative the night before the procedure. I will be sedated during the procedure. I should avoid eating solid foods for 24 hours before the procedure. D. I should avoid eating solid foods for 24 hours before the procedure. Correct answer. The correct answer is D because the statement indicates a need for further teaching. The client should avoid solid foods for a specific period, usually 24 hours, before a colonoscopy to ensure a clear view of the colon. This helps the healthcare provider to perform the procedure effectively and reduces the risk of complications. Choices A, B, and C are incorrect because having clear liquids up to 2 hours before, taking a laxative the night before, and being sedated during the procedure are all standard preparations for a colonoscopy and do not indicate a need for further teaching. Question 12. A client with cirrhosis is experiencing ascites. Which dietary instruction should the nurse provide? Increase protein intake. Limit fluid intake to 1,500 ml/day. Consume a low-sodium diet. Take a daily multivitamin. C. Consume a low-sodium diet. Correct answer. The correct answer is C. Consume a low-sodium diet. Ascites in cirrhosis is often due to fluid retention caused by impaired liver function. A low-sodium diet helps to reduce fluid buildup in the body, alleviating ascites. Increasing protein intake, A, may worsen ascites by increasing fluid retention. Limiting fluid intake, B, can lead to dehydration, exacerbating the condition. Taking a daily multivitamin, D, may be beneficial for overall health but does not directly address ascites. Question 13. When caring for a client with acute pancreatitis, what intervention is most appropriate? Encourage a high-protein diet. Administer pain medication as needed. Provide small, frequent meals. Increase oral fluid intake. B. Administer pain medication as needed. Correct answer. The correct answer is B. Administer pain medication as needed. In acute pancreatitis, pain management is crucial to provide comfort and improve outcomes. Pain medication helps alleviate the severe abdominal pain associated with pancreatitis. It is essential to treat pain promptly to prevent complications and improve the client's quality of life. Encouraging a high-protein diet, A, is not recommended as it may exacerbate pancreatitis symptoms. Providing small, frequent meals, C, may help reduce the workload on the pancreas, but pain management takes precedence. Increasing oral fluid intake, D, is important for hydration but does not address the primary concern of pain relief in acute pancreatitis. Question 14. A client with end-stage renal disease, ESRD, is receiving hemodialysis. Which assessment finding indicates a need for immediate action? Weight gain of 1 kg since the last dialysis session. Blood pressure of 150/90 mmHg, potassium level of 6.5 milliequivalent/L, hemoglobin level of 10 g/dl. C. Potassium level of 6.5 milliequivalent/L. Correct answer. The correct answer is C. Potassium level of 6.5 milliequivalent/L. High potassium levels in ESRD patients can lead to life-threatening cardiac arrhythmias. Immediate action is needed to prevent complications. A. Weight gain may indicate fluid retention, but it's not an immediate concern. B. Blood pressure is elevated but not an urgent issue. D. Hemoglobin level of 10 g/dl is within the acceptable range for ESRD patients and does not require immediate action. Question 15. A client is receiving discharge teaching after a total hip replacement. Which statement by the client indicates a need for further teaching? I will avoid crossing my legs when sitting. I can sleep on my side as long as I use a pillow between my legs. I will avoid bending at the waist to pick things up. I can bend down to tie my shoes after 2 weeks. D. I can bend down to tie my shoes after 2 weeks. Correct answer. The correct answer is D, because bending down to tie shoes after only 2 weeks post-total hip replacement can put strain on the hip joint and increase the risk of dislocation. The client should avoid bending past 90 degrees to protect the new hip joint. Choices A, B, and C are all correct statements as they promote hip joint protection and reduce the risk of complications. Question 16. A client with deep vein thrombosis, DVT, is receiving heparin therapy. What is the priority assessment for the nurse? Monitoring blood pressure. Checking the activated partial thromboplastin time, APTT. Assessing for signs of bleeding. Measuring calf circumference. C. Assessing for signs of bleeding. Correct answer. The correct answer is C. Assessing for signs of bleeding. This is the priority assessment because heparin therapy increases the risk of bleeding. Signs of bleeding include bruising, petechiae, blood in urine or stool, and excessive bleeding from wounds. Monitoring blood pressure, A, is important but not the priority in this situation. Checking APTT, B, is important for evaluating the effectiveness of heparin therapy but does not take precedence over assessing for bleeding. Measuring calf circumference, D, is used to detect changes in calf size due to DVT but is not the priority assessment while the client is on heparin therapy. Question 17. A healthcare professional is assessing a client with rheumatoid arthritis. Which assessment finding is most characteristic of this disease? Asymmetrical joint involvement. Heberden's nodes. Morning stiffness lasting more than 30 minutes. Pain that worsens with activity. C. Morning stiffness lasting more than 30 minutes, correct answer. The correct answer is C. Morning stiffness lasting more than 30 minutes. This is characteristic of rheumatoid arthritis due to the inflammatory nature of the disease. The prolonged morning stiffness is a hallmark feature, reflecting the systemic inflammation present in rheumatoid arthritis. This symptom is not typically seen in osteoarthritis, which rules out options A and B. Pain that worsens with activity is more indicative of osteoarthritis as opposed to rheumatoid arthritis, making option D incorrect. Question 18. A client with a history of gastrointestinal bleeding is taking warfarin, Coumadin. Which instruction should the nurse include in the teaching plan? Avoid eating foods high in vitamin K. Take aspirin for pain relief. Report any signs of bruising or bleeding to your healthcare provider. Limit fluid intake to 2 liters per day. C. Report any signs of bruising or bleeding to your healthcare provider. Correct answer. The correct answer is C. Report any signs of bruising or bleeding to your healthcare provider. This instruction is crucial because warfarin can increase the risk of bleeding, especially in clients with a history of gastrointestinal bleeding. Reporting any signs of bruising or bleeding promptly allows for timely intervention to prevent serious complications. A. Avoiding foods high in vitamin K is not necessary, as consistent intake of vitamin K containing foods can help maintain stable anticoagulant levels. B. Taking aspirin along with warfarin can increase the risk of bleeding and should be avoided. D. Limiting fluid intake is not directly related to the management of warfarin therapy or gastrointestinal bleeding. Question 19. When caring for a client with pneumonia, what intervention is most effective in preventing the spread of infection? Administer prescribed antibiotics on time. Encourage the client to use a tissue when coughing. Place the client in a private room. Perform hand hygiene before and after client contact. D. Perform hand hygiene before and after client contact. Correct answer. The correct answer is D because performing hand hygiene before and after client contact is crucial in preventing the spread of infection in pneumonia. This intervention helps in reducing the transmission of infectious agents from one client to another and from surfaces to clients. It is a fundamental infection control measure that minimizes the risk of spreading pathogens. Option A is important for treating the infection but does not directly prevent its spread. Option B is a good practice to contain respiratory secretions but may not be as effective as hand hygiene. Option C isolates the client but does not address the primary mode of transmission through contaminated hands. Question 20. A client with a long history of smoking is being assessed by a nurse. Which finding is a common complication of chronic obstructive pulmonary disease, COPD? Decreased anteroposterior chest diameter. Increased breath sounds. Prolonged expiratory phase. Increased chest expansion. C. Prolonged expiratory phase, correct answer. Step-by-step rationale. 1. COPD is characterized by airway obstruction, leading to difficulty exhaling. 2. Prolonged expiratory phase is a common finding due to air trapping. 3. This leads to hyperinflation and increased residual volume. 4. Decreased anteroposterior chest diameter is not typical in COPD. 5. Increased breath sounds and chest expansion are not common in COPD. In summary, choice C is correct because it directly relates to the pathophysiology of COPD, while the other choices are not consistent with the condition. Question 21. A client with chronic obstructive pulmonary disease, COPD, who has been receiving oxygen therapy at 2L/min now has a respiratory rate of 10 breath/min. What action should the nurse take first? Increase the oxygen flow rate to 4L/min. Administer a bronchodilator via nebulizer. Encourage the client to take deep breaths. Assess the client's mental status and level of consciousness. D. Assess the client's mental status and level of consciousness. Correct answer. The correct answer is D. Assessing the client's mental status and level of consciousness. This is the first action to take because a respiratory rate of 10 breaths/min in a COPD client receiving oxygen therapy may indicate respiratory depression or impending respiratory failure. Assessing mental status and level of consciousness can help determine if the client is experiencing hypoxia. Increasing oxygen flow rate, A, without assessing the client first can be dangerous if the client is retaining carbon dioxide. Administering a bronchodilator, B, may not address the underlying issue of respiratory depression. Encouraging deep breaths, C, may not be appropriate if the client is in respiratory distress. Question 22. During an acute asthma attack in a client with asthma, what medication should the nurse administer first? Oral corticosteroids. Short-acting beta agonist. Leukotriene receptor antagonist. Long-acting beta agonist. B. Short-acting beta agonist. Correct answer. The correct answer is B. Short-acting beta agonist. During an acute asthma attack, the priority is to quickly relieve bronchoconstriction and improve airflow. Short-acting beta agonists like albuterol are the first-line medications for acute asthma exacerbations as they act rapidly to relax smooth muscles in the airways, providing immediate relief of symptoms. Oral corticosteroids, A, are important for long-term management but do not provide immediate relief. Leukotriene receptor antagonists, C, and long-acting beta agonists, D, are not appropriate for acute asthma attacks as they have slower onset of action and are used for maintenance therapy. Question 23. A client with hypertension is being taught about lifestyle modifications. Which statement by the client indicates a need for further teaching? I will reduce my sodium intake to help control my blood pressure. I need to start walking at least 30 minutes most days of the week. I can continue drinking alcohol as long as it is not in excess. I will check my blood pressure regularly at home. C. I can continue drinking alcohol as long as it is not in excess. Correct answer. The correct answer is C because excessive alcohol consumption can raise blood pressure. Step 1. Alcohol can lead to hypertension. Step 2. Limiting alcohol intake is crucial in managing hypertension. Step 3. Choices A, B, and D promote healthy behaviors that help control blood pressure. Summary: choice C is incorrect as it goes against hypertension management, while choices A, B, and D align with lifestyle modifications for hypertension. Question 24. Prior to a cardiac catheterization, what is the most important action for the nurse to take? Ensure that the client has been NPO for 6 hours before the procedure. Administer pre-procedure medications as ordered. Verify that informed consent has been obtained. Assess the client for any allergies, especially to iodine or shellfish. D. Assess the client for any allergies, especially to iodine or shellfish. Correct answer. The correct answer is D. Assess the client for any allergies, especially to iodine or shellfish. This is crucial because contrast dye containing iodine is commonly used during cardiac catheterization, and a client with allergies to iodine or shellfish can have a severe allergic reaction. It is essential to identify allergies beforehand to prevent any potential adverse reactions during the procedure. A. Ensuring NPO status is important for some procedures, but assessing for allergies is more critical to prevent life-threatening reactions. B. Administering pre-procedure medications is important, but assessing for allergies takes precedence to avoid allergic reactions. C. While obtaining informed consent is necessary, assessing for allergies is a crucial safety measure to prevent allergic reactions during the procedure. Question 25. A nurse is caring for a client post-myocardial infarction, MI. What is the priority assessment for this client? Monitoring urine output. Checking blood glucose levels. Assessing for chest pain. Monitoring electrolyte levels. C. Assessing for chest pain. Correct answer. The correct answer is C. Assessing for chest pain. The priority assessment for a client post-MI is to monitor for any signs of recurrent chest pain or angina, as it could indicate ongoing cardiac ischemia or a new infarction. Prompt intervention is crucial in these situations to prevent further damage to the heart muscle. Monitoring urine output, A, and electrolyte levels, D, are important assessments but do not take precedence over assessing for chest pain. Checking blood glucose levels, B, is relevant for diabetic clients but is not the priority in this case.